Okay, let's have a quick look at this letter. It's in what group's this? OET study group, I think. Is it? OET study group. Yes, it is. Let's have a look. So, Amina Ahmed. So, now I don't usually make comments on photographs because it's, I can't add any comments or changes, so I'll just have to speak over them instead, and you'll have to take note accordingly. So first things first, aged 8 or age, so either age 8 or age 8 years old. So okay, aged 8 years, no, it's either age 8 or 8 years old. So thank you for urgently seeing Amina, whose features are consistent with meningococcal meningitis. Your fair version treatment will be highly appreciated. Okay, now these, right, again, I keep saying this, highly appreciated. If you can find me an official OET sample of an E2 sample where this phrase is used, then send it to me and I'll give you a prize, because you're not going to. Nobody uses it, and they don't use it for a reason. It's a template. It's a nonsense fixed sentence. It's not English. It's a memorized sentence. So try not to use it. All you need for your purpose. What do you want the reader to do? I am writing to request your evaluation and treatment of Amina, whose features are blah, blah, blah. Okay? You don't need to thank them. You can thank them at the bottom, down here. You can thank them here, but your purpose needs to be clear. I'm writing to request your urgent assessment. I'm writing to update you on blah, blah, blah. Get that done first. Now, Amina's problems seem to have initiated. Seem? What? So they did or they didn't 5 days ago when she could not attend school because of it. Right. So, did she come to see you or not? Presumably, yes. So, initially, Amina presented, presumably with a mother or parents, on what's the date when she was complaining of blah, 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 blah. Okay? That is better. They like you to have dates and references to time, so the reader knows precisely when the events occurred. And seem to have initiated. Why is that a passive? To have initiated? They were. So, I wouldn't do it like that. Let's have a date. Amina presented on the 25th, was it 14th at 10th? So that would be, what's that, 2012, is it? So, whatever date, 5 days ago, what's that, on the 9th of the 10th? Okay. When she could not attend at school, well, who cares whether she went to school or not? What was her symptoms? What did she come in with? So she presented because she had fever, rhinorrhea, and cough. So either a cough or she was coughing, or with bouts of coughing. Apart from a raised temperature of, it's got to be grammatically complete sentences, not in note form. Apart from a raised temperature of, other findings were unremarkable. So if they were unremarkable, why mention it? We don't need it. Tell me what you found. A simple viral infection was suspected and advised. What, the infection was advised? Who was advised? According to this, the infection was advised. So, who was advised? And why would you use that? So, I'm advising you that your daughter. What did you advise? What was your advice? So, a typical visit, a paragraph, right? 3 components. The patient comes, the patient says what you found, what you did. A patient comes and says, oh, doc, I've got this pain, blah, blah, blah. You take a look at the feel. Oh, you found this. You take action accordingly. That's what you need for a paragraph. Upon follow-up, 3 days later, Amina's condition further worsened. Well, if it's 3 days later, it's in the past, you would use past perfect. Had worsened with non-resolving fever and new onset headaches. However, neck stiffness was absent. However, well, you use however to indicate a contrast. But if something wasn't there, then there's no need because it's not a contrast. Unless you were expecting neck stiffness to be found, which is not that clear. Blood and urine tests were ordered and can't read that. 200 milligram was commenced, so you prescribed. Okay. On review of reports today, I presume that's reports. Blood test reveals. So, the blood test, her blood test, we need either an article or a pronoun. It's supposed to be writing grammatically complete sentences. Reveals Lecoqui, I can't even read that. Tosis 1800 with left shift and a normal urine function. Now, I wouldn't put. Why do we have an article here? Function. That's function in general. It's not a specific function, is it? And a normal urine function. However, I mean that 2 episodes of vomiting and her fever is still persistent. On examination, her temperature, again, complete sentences, was 40.2 degrees C. Her pulse was, well, now, I would put was for the pulse. Because it's a pulse, it changes, it's not kind of constant, yeah? So I would put her pulse was, because at that time, presumably this morning, you're writing it later, so it might have changed. Her pulse was 110 beats a minute, and newly appearing, can't read that, papular rashes are noted. Well, were noted, because again, it was on in the past. Please note that neck stiffness test is also, so again, article or a pronoun, and neck stiffness test is also positive, was also positive because you wrote it this morning. The above findings are highly suggestive of meningococcal meningitis. Penicillin injection first dose is given. How's that? How's that a secondary clause? Was given by whom? To whom? The above findings being highly suggestive of meningococcal meningitis. I gave Amina her first dose of penicillin by injection. Amina has no known allergies, comma, she has a history of appendicitis. So she had an appendectomy. You can count it. So Amina has no known allergies, comma, she had an appendectomy 2 years ago. In view of the above, now, why would you put that there? So you know, you're going through this stuff about she's got this and this and that and this and that and then she's got no knowledge. That would have worked better earlier, I think, in the letter. You could put that very, very briefly, paragraph 2. Please note Amina has no known allergies, though she had nothing. I mean, matter of fact, we don't even need that. Really, this is supposed to be urgent. I mean, immediate, urgent. So she had an appendectomy a couple of years ago, and she doesn't have any known allergies. I would be tempted not to even use that. You know, because it's supposed to be urgent. Oh, she's got meningitis, blah blah blah. You could have omitted that, and it would have been fine. In view of the above, I am referring Amina for immediate admission to your hospital. Should you have any queries, please don't hesitate to contact me. Okay. So, your purpose, you need to make it clear, I want you to do X, Y, Z. In your letter, you construct a narrative to tell the reader why you want them to do X, Y, Z. and you make it clear, you spell it out at the bottom. In view of the above, I want you to give urgent admission to, assess server, do blah, 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 blah. Okay. So, not too bad, but there's too many grammatically incomplete sentences here. So, I take a look at those. Now, again, because it's not typed out, I can't add any changes here. So, you'll have to play this back and have a listen and take note. So, next time, if people want anything assessing, try and type it out. Okay.